All right. Good afternoon, Kentucky. It is 4 o'clock on Thursday, which means unless there is something unforeseen, this will be our last one of these this week, and we'll be back Monday at 4. Let me first start the way we always do, or the way we should always do, by remembering we're going to get through it, and we're going to get through it together. And one of the groups that are going to help us to get through it together are the Fort Wright Falcons. They are in Kenton County. Appreciate their spirit, making sure that their students can both show pride in their school as well as when they return to in-person classes on September 28th to be safe. So today is the first day of the Kentucky State Fair. It's opening day. A state fair is such an important tradition that has been going on for so long here in Kentucky. And the State Fair Board has worked hard to deliver something that can still go on. Many states around the country, most of our neighbors have canceled their state fair. But our State Fair Board not only engaged in good planning, but also courageous decision making, realizing that with the virus where it is right now, that they needed to make significant changes even to something that people love so much. They did the right thing. It's a good example that we should all watch and try to follow. This year's fair is participant only. It features wider aisleways, reduced occupancy, increased hygiene, accessibility, and facial covering requirements. Although the fair looks different, it still highlights our agricultural traditions. It still has the 4-H and FFA youth showing dairy cows and goats, which the photos are up here. With over 76,000 farms, 240,000 horses in the Commonwealth, the State Fair does truly show such an important part of what makes us Kentuckians. And I'm proud that at the end of the day, the most important thing was our youth, was why we had a state fair to begin with. And that we were willing to sacrifice rides, that we were willing to sacrifice the double fried donuts, that we were willing to sacrifice so that we could make sure that these kids got the opportunity to, in a safer environment, participate. This is an example of how we get things done here in Kentucky. And let me say, I'm sure the Kentucky State Fair Board had a lot of pressure put on them. But they did the right thing. And for that, we appreciate them. Now, I got a couple of updates from Secretary Eric Freelander, and after that, we will do our update for the day.
Thank you, Governor. So the first thing I'd like to talk about today, I'll talk about this first. The first thing I'd like to talk about today are Meals on Wheels. You've seen in the past where we talked about how many meals we've been able to deliver. That picture is Governor Beshear delivering our 1,000,000th meal in July. Since then, we have added another 400,000 meals that we've been able to deliver since then. This is a 200% increase in meals that have been delivered across Kentucky. This has been and is an important outline for our seniors. This helps them maybe with the one meal a day. This helps them know that we care about them. And there are stories all across the Commonwealth. And in our smaller counties, this has been true more than any place else, of people stepping up and volunteering, restaurants, grocery stores, meat packing plants, providing additional meals, providing additional staples for our seniors across the Commonwealth. This is one of those success stories about why it makes me proud, and I think it should make us all proud to be Kentuckians. We still need assistance. If you're 60 or older and you need meals, please reach out to our Aging and Disability Resource Center. The number there is 877-925-0037. 877-925-0037. If you need some assistance with meals, please call that number. And we are always looking for volunteers to deliver meals. We've had a great outpouring of volunteers across the Commonwealth, but we can always use more. So thank you. This is a great story, and we are going to continue to do that. We're going to use some of the CARES money to make sure that we get through the end of this year, because we've had such an increase. Some of our smaller counties need some assistance, and we are going to provide that. So this is something that I think, as Kentuckians, we know our response has been fantastic, and it will continue to be. Next, I think it's the 11th thing you can do, and that has been a part of the governor's press conferences, but that is answer the census. There is still time. You can still go online to 2020census.gov and answer the census questionnaire. We're up to about 66, 67% response rate. It is better than in some of the previous censuses, but there is so much more we need to do. And the door-to-door is going to be cut short by about a month. So you need to go online. Please answer the census. This is how we make sure that we have funding for our schools. This is how we make sure that we have funding for our roads and our teachers and our health care. And by the way, it's how we make sure we have enough funding for our Meals on Wheels. So please, this is one of the duties as a U.S. citizen, as a Kentucky citizen, answer the census. Thank you.
All right, I know we can do better than 66%. That is just 2/3 of us. So come on, everybody. It's okay if you haven't filled it out yet, as long as you fill it out. It's not okay if you don't. So go online, get it done. It takes about 2 minutes. We continually talk about coming out of COVID-19, which we all want to desperately do. What the world will look like, the dollars we have to invest in Kentucky, our ability to help everybody have more opportunity. So much of that is going to depend on the census. We're doing a lot for each other right now. We're wearing masks, we're staying 6 feet apart, we're cutting down our contacts. We're doing a lot for each other right now. So just do one more thing and spend these 2 minutes. It is well worth it, and it will help our state. Today's COVID report is it's good news and bad news. More cases than we want, but a positivity rate has actually gone down a good amount, one that I'm happy to see. Of course, it bounces given the 7-day average. But today we're reporting 726 new cases of COVID-19, which means this virus is still out there. It's still aggressively spreading. And it means that when you remove the duplicates, which we did from yesterday, 26, again, anybody who's concerned about the data, we go over it every single day to make sure that we can improve it. Our total cases are now 41,626. Our positivity rate now down to 5.18%. That's good news. Here's the really hard news. We're announcing 14 new deaths today. We had 12 yesterday. We had 12 the day before. It's 38 deaths in just the last 3 days. We have to understand that this is not just real, but when we have, it takes lives from us. And when we have weeks, and we're going to have another week, where we have almost 4,000 cases, it means even with the smaller mortality rate, even with us doing better, that we're going to lose more Kentuckians. It's basic arithmetic. So let's make sure that we make the right decisions to keep our cases low. Let's make sure that we wear our mask and stay 6 feet apart. These 14 families, they're also going to need your help. So keep those green lights going. Ring your bells at 10 a.m. The 14 from today include a 81-year-old man from Fayette County, a 95-year-old woman from Clay County, an 88-year-old man from Fayette County, a 55-year-old healthcare worker at a long-term care facility from Graves County, I think this is Marion County's first death, a 57-year-old man. A 65-year-old healthcare worker, a woman from Pulaski County. We lost 2 of our frontline workers today. 84-year-old woman from Harlan, 96-year-old woman from Harlan, a 77-year-old woman from Hopkins, an 88-year-old female from Gallatin, a 76-year-old man from Warren, a 66-year-old man from Barron, an 89-year-old man from Jackson, and the family of the last individual asked us to not read out this information tonight, and I'm going to honor that request. We have 638 Kentuckians in the hospital right now with COVID-19, 155 in the ICU and 108 on a ventilator. Please pray for them, just like you do the families of those that we have lost. We've now done over 794,282 tests. That means we had about 9,100 tests from yesterday to today. That increases that denominator. That's why the positivity rate is down. We haven't done the racial breakdown of cases in a couple days. So of overall cases where race is known, 79.19% white, 12.52% black, 5.67% multiracial, just over 2% Asian. On ethnicity, 87% non-Hispanic and 13% Hispanic. And then I don't believe that I have the death statistics here, but they will be posted on the website. They continue to show disproportionate impact on our black community. Again, we have to be committed to changing that, and we're working on that right now here in Kentucky as we're trying to sign up every single Kentuckian for health care, but prioritizing those communities that are hit the hardest right now during COVID-19. That's how we save lives. That's why you set the priorities you set, and it's also the right thing to do. New cases by county: Jefferson 164, Christian 70, Fayette 56, Warren 45, Kenton 34, Bullitt 15, Knox 14, 13 in Davis and in Hardin, 12 in Marion, McCracken, Nelson, 11 in Boone, Graves, Hopkins, Madison, and 10 in Campbell. Today, of the 726 positives, 101 of them are in kids, 18 years and younger. A number of school-age kids in school districts that I believe are starting as early as this coming Monday. A 16-year-old in Barron County, an 18-year-old in Hardin County, and 5 school-age kids in Warren County. 14, 11, 9, 17, and 7. I certainly hope those contact tracers are working really hard right now and that we learn very quickly that these folks were positive. Otherwise, it's going to present a heck of a challenge on Monday at a time when this virus is so hot and we are seeing the spread that we are seeing. On the good news, we are still seeing a lot of people willing to show up and be tested, and that's really important. It's really important because it gives us better data on decisions we make, but more than that, it helps us find out when somebody is asymptomatic so that they don't spread the virus further, but it also helps us find out when somebody is positive so we can watch over them. Because sometimes you don't have many symptoms, you just have a little, and then people get hit really hard. We want to make sure that people are watching them, that we can take care of each other, and that we can do even better at stabilizing our folks, making sure they get over this and get home, even better than we've done thus far. The racial breakdown on deaths: 96.43% non-Hispanic, 3.57% Hispanic. And then on race, 82.15% white, 13.92% black, 2.53% multiracial, and 1.39% Asian. Long-term care. Again, you always have good news and tough news. The good news is only 4 new residents. The tough news is 20 new staff. Total deaths, 5 new residents there. Those are from previous reports, but now attributable to long-term care. I think in a lot of comments we've recently heard, people have either tried to attack the numbers or just treat them as numbers and not as reality. But the people that we lose that would otherwise be here are people that are loved by their families. So today we have a tribute to Huey Cornelius, 81, died last Tuesday from COVID-19. Oh, look at that family picture. Huey and his wife actually entered the hospital on the same day, both COVID positive. His wife recovered and returned home while Huey battled the virus for 3 weeks before his passing. During those 3 weeks, his family stated the team at UK Hospital treated them with dignity, humanity, and class. Huey had no underlying health conditions. He was an active 81-year-old. And I want to look like that when I'm 81 years old. No underlying health conditions, and active. He was an educator, a principal, a coach, a neighbor, a Sunday school teacher, an insurance salesman, a friend, an uncle, a brother, a grandpa, a husband, and a father to 4 children. One of his children, Brance, asked that we share his story in the hope that Kentuckians will honor his father by doing everything they can to keep each other safe and prevent other families from enduring such a painful loss. We will miss Huey, and today I wear my mask for him, just like we wear our masks every day to care for, to protect, and sometimes to remember. And thank you to Brance. This is very public, I get it. And it probably really hurts to see it up here. But somebody who's an educator teaching us even after he's passed, I think, is an important lesson that we can all take. And you know what? People are hearing these lessons. They're seeing the importance of wearing masks. They're getting out there trying to make good decisions. They're hopefully staying 6 feet apart. And they are showing that pride on social media, where they want to show that doing the right thing can help us all to get through this together. So this first one is one of our educators who is talking about her academic team, but giving them a shout out on the resiliency of their school. Pretty neat. Again, I try to wear one of these every single day to recognize the pride that we are seeing. The next one is something that I find funny. When somebody takes a picture right now and you're wearing a mask, do you smile? I do. You can still smile under them, and I think people can tell when you are. And just because we have to do something strange doesn't mean that we have to stop being the good people that we are. This one made me smile, so I appreciate it, Jefferson. How about this one? Virtual kindergarten starting yesterday, picking up the toolkit, getting ready. Listen, being a parent with your kid doing NTI is hard, I know, but it keeps them safe. I mean, I look at the back of that car, and that is precious cargo. As a child of God, just like every child, and we are trying to do our best to make sure that we make the right decisions to keep them and others safe. All right, this last one is Pilgrim Baptist. These are volunteers, a nonprofit in Lexington. They've delivered 3,700 breakfasts and lunches. We love that they're wearing their mask. Maybe next time they could spread out a little bit more for the picture, but we really appreciate all their hard work. This is a special church in Lexington that I've had the opportunity to worship in, and look forward to having the chance to go back when we are all safely doing that around the Commonwealth. All right, so with that, I think we are going to open it up for questions. It's a Thursday afternoon, so I thought that we would get through this. And I know that we're going to have questions on a number of topics. Some we will have the information, some will have to wait until Monday. We hope to have our eviction announcement today. It will be on Monday. Again, there are a lot of moving pieces in this. We want to make sure that it works, and that when we put it into place, it works and works quickly. I started over here yesterday, at least I think I did. That's right, because I asked Lawrence, and he was honest with me yesterday about where we started. So we'll start with Debbie today.
No, not honest. Have you heard any updated plans for the Kentucky Derby, and have you decided whether to attend?
I have not heard any updated plans on the Kentucky Derby, and honestly, in the midst of all of this, I have not spent a lot of time thinking about whether I'm going to attend. I'm sure that decision can be made closer to it. My job right now is to do the best I can in making decisions related to COVID-19, prepare our state for when we move out of this, and just haven't spent a lot of time thinking about it. I would only go if it is appropriate, given all the circumstances that are out there, if it's safe, and if it's setting a good example. Lawrence.
Do you know if 14 is the highest single-day total so far?
I believe we've had a day that is higher than 14. The question is today's death count the highest we've seen? I do not remember a time where we had double-digit deaths for 3 straight days. I can't remember a time that we have, and I'd be very surprised if this isn't our highest 3-day period, but it's going to continue. Remember when we said it's going to be a tough August? That's because of what we had in July. James, can you put the stair-stepping chart up? We've done a good job at pushing down the mortality rate, but this thing is still so much deadlier than things we regularly encounter, like the flu. It is not a flu. And if somebody eventually in a back and forth talking about safety says, yeah, but the flu, then they don't really think this thing is real. And that's when it all ought to break down. When we look at what happened in July and those cases, so many, even getting a mortality rate down, I think 2% or below. I haven't seen what today's is. What do we have, Kelly? Do you know? Will you check? With that many cases, the deaths follow 2 weeks to a month right after. Sure.
With the numbers still being in the 700, 600 around that area, and the number of deaths, how can you say that, for example, the masking thing is still working, and then
the question is why do I believe that the mask mandate is working given these numbers? It's because we were headed the way of Florida and Texas and Alabama and others. You could see our curve just as easily as everybody else's, and we blunted it. Right? Originally, when we flattened the curve, we didn't. It didn't immediately go down. We plateaued it, and that was us taking steps. That was being healthy at home. This is we see the direct impact, and you can see it in how the cases aren't going up exponentially anymore. But it's going to take us a little bit of time to start coming back down. And remember, just because we have a mask mandate doesn't mean we're all wearing them, and doesn't mean we're staying 6 feet apart. But our compliance is a lot better. Oh no, we would be well above that right now without it. Joe.
What more can you tell us about this eviction announcement that we've been talking about the last few days? The delay in getting it out there, and there's a lot of anxiety with landlords and with tenants.
Right. The question is, what can I tell you about the eviction announcement that we will now make on Monday? I'll tell you why we have the delay, and we're going to put some CARES Act money into the program. And that means we have to set up the administration part of it to have the dates that everything can be up and running. And that's a lot of work we're doing really fast behind the scenes. And those that work closely with me will tell you that they give me a time frame, and I ask them to do it about 3 times faster because of where we are. And so it's that administrative piece. And so for many landlords, I hope that's worth waiting, or many renters, another 4 or 5 days because we don't just have to deal with the current, right, which is we don't want people put out on the street, not during COVID-19. But I also don't want them emerging from this when we get through it with so much debt piled up that they're going to be evicted in large numbers afterwards. So if we can get a plan in there that puts some real money in, and multiple pots of money exist out there, we want to pull them all together, then hopefully we can get some good outcomes for people where they're not just protected at the moment, but they got a lot more hope into the future. Tom.
Governor, what are your thoughts on the Kentucky High School Athletic Association vote this morning to keep going with fall sports?
Yeah, I got about 4 of those questions here. The question is on the KHSAA taking a vote today to move ahead with, I think, all fall sports on the regular schedule. Admittedly, I was surprised. We know a lot about this virus now. We know that it spreads by contact, and we know the closer the contact, the easier it can spread. And so I thought it was pretty logical to say, okay, let's look at all the sports, and let's see what has the lowest contact down to what has the highest contact. And at a time when the virus is really high, we play the sports with the lowest contact. They have the greatest percentage of being successful. And that we would wait for the sports that have the highest contact. That's both for the safety of athletes, but also, do you want to be able to play a full season? And if so, when you choose to start it, we'll determine the likelihood that you'll be able to finish it. And so, one of the things that I had thought through is, do we want to start at a time where we have a 10% chance of getting through the season, where we might play 2 games? Or do we want to start at a time where we think we can get through 10 games and people have a full and complete season? Another thing that struck me is if some of the early sports aren't successful and have to cancel their season, they could lead to a cancellation of other sports coming after that based on this virus. And that would worry me if I'm in some of those other sports. But I'm going to take some time to think it through. I'll certainly be thinking about safety first and foremost. I believe a student athlete is a student first and an athlete second. And just about all of our student athletes out there are ultimately going to make their livings with their mind. And then the second thing that I'm going to think through is the chances of success. And from us, I don't know what's going to come out of it, if it's going to be a strong recommendation, if it's going to be advice, if it's going to be something more than that. But certainly surprised with the virus at its height that it's just move ahead. I look at and think about our kids the same way as that kid in the back of the car. I know they're different, and I know our kids want to play. But we can't just let our kids be responsible for those decisions. If I let my kids decide things, we'd have ice cream every night, and that wouldn't be very good for me. But let's remember, as we go through this, and I know this will be a hot topic amongst parents, we are in the midst of a pandemic. And we still don't know the long-term effects that this can have on people's health.
I believe it was yesterday when you were referencing the yellow counties and red counties
Yeah.
of the White House report. The Center for Public Integrity actually gave me a copy of the White House report for Kentucky and several other states. It says that Kentucky is in the red zone, and it has that breakdown of counties. For counties in the red zone,
And I think that's a week old, the one.
this is from August 6th.
Yeah.
Okay. But their recommendation is for counties in the red zone to close bars and gyms and surge testing, amongst other things. Counties in the yellow zone, they recommend reduce gym capacity to 25%, close bars until positivity rate is under 3%, and encourage public officials to use messaging that people should not be going to bars or nightclubs. Do you believe that is sound advice? Would be adopting that advice?
So the question is on the White House report, which shows red counties and yellow counties. And, I saw some commentary that we shouldn't be showing this. I mean, this is the data from the White House that they believe shows dangerous areas. And listen, I think we ought to be fully transparent. And I'm a little concerned that those that don't think we should be showing this just don't like either where their county is or don't like the answer that it gives. But that in and of itself is really concerning. If we judge whether or not we think information should be out there by what it lets us do or not do, we're not making a decision with our heads. We're making decisions to just try to go back to our old life. Listen, this is their data, and I think it's important to show to people. Now, they do make recommendations that we did for a 2-week period across Kentucky in red counties. They think we should continue to have restaurants at the 25% capacity and the bars closed. We believe, and we have discussed this with the White House, we discussed the duration we were going to do, that with our new rules, we are in that we are doing what we need to do for these red counties. But we're certainly going to continue to look at the recommendations they make. I believe that Dr. Birx and the White House would say that we have communicated well and we are taking aggressive action in and around these counties. But That report just talks about the red counties, and you want to show the yellow counties. What the White House and their doctors have been very clear on is when you have this many counties in the red and the yellow, you have uncontrolled spread across the state. So I don't like saying that, right? I'm trying to lead us through this, and I don't like saying that we have uncontrolled spread around Kentucky. I don't like that, but that's our reality. And if we can't admit where we are and the obstacles that we face, we can't put our best foot forward, we can't make good plans, and we can't protect each other. Now, if we deny the problem, well, we lose more Kentuckians, and we compromise the long-term health of people.
I've been trying to get a hold of a child's grandmother all week to talk about starting school. She finally calls me back today, and the first question she asks is, what'd the governor say, is school opening up next week? So my question is, when you hear things like that, does it make you a little concerned about children? And I'm not saying the children are bad home, but does it make you concerned for a child maybe not being able to keep up because communication, just in general?
Yeah, this is a question that shows how hard this virus is. It's a text message from a teacher saying they had tried so hard to reach a child's caregiver who is her grandmother, or the child's grandmother. And then communication issues there, the grandmother not knowing when we'd recommended that school be open. And am I worried that in NTI some kids are going to have a harder time based on their situation? Yes, I'm really worried about it. But this is a child whose only caregiver is one of her grandparents. And even with, I just think having that grandparent still there with them is so critically important. And right now, at a time where the virus is as big as it is, it would threaten the future of that child's caregiver. But is in-person classes better than distance learning? Absolutely. Any day of the week. Do more kids keep up in in-person classes than distant learning? Absolutely. And I'm fully committed to getting us back to in-person classes. But to threaten maybe the one person that's still there for so many children being raised by their grandparents who have already lost a parent, whether it's in many cases to an overdose or that parent not being in a place where they can be a parent, and to make decisions that would threaten that last person that might be there for them, knowing where we are as a state right now, those grandparents are counting on us too. Debbie?
On evictions, if you don't have an announcement until Monday, there's a different status quo as people be evicted promptly.
Well, our current executive order on evictions is still in place, which means there shouldn't be enforcement. I hear that some are just going to go ahead and supposedly enforce orders. There does have to be a proceeding for evictions, which the Supreme Court just opened up, but they still have to be filed and they still have to go to court. So I believe in general, for most circumstances, we still should have time. Would I prefer to have the announcement today? Yes. But do I want to make sure that it will work when we announce it? Yes. and so we believe that there's going to be a lot of different groups impact this, right? There's the different funds that are out there, state and federal. There's the different organizations and things like legal aid that help folks out. There's the court system that has the pilot program in Jefferson County. So putting together something that's going to work, and we're going to put together something that's going to work, is just pretty intensive, and we want to get it right. We would have had it today, but I insisted that we add an extra layer that will allow people to get help a little earlier, or at least to get applications in a little earlier. So Monday we will have all these details. I wanted to have it yesterday, but here we are. Lawrence.
Just for clarification, have you not decided yet when you're going to approve the KHSAA recommendation?
I haven't received the written KHSAA recommendation. I'm certainly not going to make a decision before I get it. And I may want to ask their commissioner some questions. We've communicated before. I want to know a little bit more about some of the rationale of folks that are there. So it just happened today. I'm going to take a breath and make sure that I'm thoughtful about what we do.
You did say you were surprised. Why were you surprised by the recommendation?
I was surprised by the recommendation because with the current level of the virus, listen, if I was somebody wanting to play a 10-game season in a high-contact sport, starting it now, the odds aren't good. Yeah, and when I played sports, I loved the season. I loved that idea that you were going to play X number of games and you were going to try to have a good record. And I just think that if things move forward in a way that doesn't set us up for success, it could have a domino effect on other sports and other teams. I just think with high contact and low contact, we put that out in our guidance. We've had that out there for months. And golf, tennis, some other things right now make a whole lot of sense. But we'll look at what they have. Yeah, I do not have any updates and haven't received them from either Louisville or the Attorney General on the Breonna Taylor situation, on the investigation, not the situation. It's an investigation that we are waiting on a determination from the Attorney General. We'd gotten a little bit of information and process from the Attorney General a week or maybe 2 weeks ago, and I think that was helpful. It is my hope that if it's going to take more time, that it can be explained a little bit of the why. I think you can do that without disclosing anything you feel like you can't under law. But again, I worry about the vacuum that's out there of a lack of information. All right, a landlord reached out to ask if there's any relief coming for property owners who haven't been able to collect rent but still have taxes and other bills to pay for that property. I believe our announcement on Monday is going to be just that. Do I have a comment on BR 130? It's a bill request for next session that redefines the governor's use of emergency powers. It puts parameters and a timeline on the use of emergency power for a governor. So I hope that we never have to face a crisis or an emergency this long. But wouldn't you worry if the time period that gave you the authority that you need was so short that we lost our will to do the right thing too early? Could you imagine if we'd had to call in a legislature that said no to the mask mandate, where we'd be right now with that exponential climb? Could you imagine if those in charge wanted to just attack the data each day because they want to be able to do some other things? Listen, sitting in this seat, standing behind this podium right now isn't easy. It's certainly not what I imagined when I ran for governor or when we won. It is heavy, unlike anything that I have ever experienced. It requires you to make decisions that you know are going to result in harm to people. I'm a person that at my core and in my faith cares, and I have to make decisions that I know are going to cause harm to people to try to help the most people we can stay safe and our economy strong. It is not an easy thing to do, and it'd be really hard by committee or by several hundred people making those decisions. And at a time when politics is so crazy, you see people throwing out names, and it's interesting in this to be called names when you're having to make the tough calls that nobody else wants to. And let me tell you, there have been more folks that have testified that publicly say local control and then privately say, please give me a mandate so that I have cover than I ever expected. We've seen a lot of courage out there. We've seen it out of the State Fair Board. And there are instances where we've seen lack of courage too. These are people's lives that are on the line. This is a crisis that's only happened once every 100 years, and we're going to lose more people by the time this is over than we did in either Vietnam or the Korean War. So they can come in and they can debate what they want. If they make us less effective in a time of crisis, if it was something like this, it'd result in more death. And I hope that that's something that they will consider and weigh, and that this thing is not just about power. I see a lot of legislators upset that I do this almost every day at 4, that I communicate directly to you. Well, first thing is, nobody got to watch if they don't want to watch. But second, don't you deserve to hear it yourself? Don't I work for you? And shouldn't you want your legislators to want to hear directly every day that you want to tune in? I think we've approached this thing with as much transparency as we can, breaking down the data in every way possible and putting it out there for you. You know, it's not easy, and I've always wondered how much I'm going to have left in the tank once we get through COVID, but I'm committed that we're going to get through it, and we're going to come out of the other side, and we're going to move forward. I'm not even sure what the question was there, but we'll keep going. Yeah, that's all right. We all lost where we were.
I know you're set to.
Oh, I did? No, I skipped Tom. All right, Tom. That wasn't your question?
You might not want this one, but I'll go ahead. I've been getting communication lately from people concerned about what consists of a COVID-19 death. That people who have had underlying conditions like cancer for, let's say, several years, and suddenly they pick up COVID while they're in the hospital or in hospice care, and then it becomes a COVID death as opposed to a cancer death. How is that determined?
So we've gone over this before. A COVID death isn't just anybody that has COVID. It has to be a contributing factor. So if you are in a car wreck, but you have COVID, that is not a COVID death. We do, I think, more than just about any state in doing not just the deaths, but the probable deaths, and in having a committee that goes back through and reviews them to determine if COVID was a contributing factor. But in the example, it was somebody that has cancer. It might be a terminal form, though, and even in that, they give you an amount of time, and sometimes you last longer. Sometimes, unfortunately, it's shorter. I've dealt with that with people I know and care about. But what will often happen is somebody might be in the hospital or hospice care, but they get COVID, they develop pneumonia, and then they pass away. In that instance, even though they have terminal cancer, COVID is a contributing factor. And let's not act like just because somebody may have limited time, that time is not precious. Maybe it's even more precious. And for COVID to steal it from that family is something that we need to recognize. But stepping back from all that, we account for deaths like the federal government tell us to. So those that are trying to say, oh, the numbers are the deaths, this is how the federal government tells us to report it. The Trump administration tells us to report it, and we do more than other states to try to make sure that there is always COVID is a contributing factor.
I believe you're set to participate in a panel hosted by the Democratic Governors Association tonight, moderated by Stacey Abrams, along with 3 other Democratic governors. Everyone involved in that panel tonight endorsed Joe Biden, Kamala Harris. Some of you have spoken or will speak during this CDC. I know you're focused on the coronavirus right now, but do you plan on offering an endorsement for Joe Biden?
Yeah, the question is on the presidential election and my endorsement. I'm going to vote for, and I'm for Vice President Biden. And for me, it comes down to a part of his character that resonates with me. One of the things that defines the Vice President is his love for his family. Which he has seen so much tragedy in, and I got to briefly know his son, Bo, for a period of a very short period of time. But the story that always sticks with me is that the Vice President would take the train home every night to tuck in his kids. Some of you all know that's a similar philosophy that I have about mine. Whether I was running for AG, serving as AG, running for governor, or serving, I go home just about every night. It's just a handful in the course of any year that I'm not home. I think during the AG's election there were 2 or 3 nights total, and I ran for 2 years that I wasn't home. We'd come home, we'd roll in at 3 a.m., but I wanted to be there when they woke up. So that's something that really sticks with me about the Vice President, and that's why I'm supporting him.
We've seen some moves in, long-term care spaces where families can see their loved ones clearly. Is there any, and I wish Michael Brown was here as well, but is there any plans, I guess, in the future for something similar to that for jails? For people to see their loved ones?
That's a good question, and I'll check. The question is that there are setups for long-term care facilities so that people can see their loved ones. Are there similar plans for jails? Let me check on that. I think it's a good question, and it's been a long time since people have been able to see their loved ones in either prisons or jails. All right, I think we've gotten around twice, right? All right, so one of the things that's happened while we were sheltering at home this spring and early summer was a big decline in the vaccinations amongst Kentuckians. The rates have come back as families feel safe. They've come back up some, going to their physician's offices, but we are still behind. And at a time when some think that the fall is going to be tough with COVID, these vaccinations are so important. They're important to your long-term health, and they're important to know when you get sick that it's not something else. And as we're about to enter flu season, getting that flu shot is vitally, vitally important. Here's a video about a new campaign launching this week from the Kentucky Medical Association, the Kentucky Foundation for Medical Care, the Foundation for a Healthy Kentucky, and Anthem to encourage Kentuckians to schedule an appointment with their physician to update their immunizations and get that annual flu shot. You'll see support from our Lieutenant Governor, Jacqueline Coleman, as well. We'll see you tomorrow. We'll see you Monday at 4.
COVID-19 pandemic. It's never been. As Kentucky continues to contend with the COVID-19 pandemic, it's never been more important to maintain your health and protect your family from getting sick. That means now is the time to raise your guard, Kentucky, by visiting your physician and updating your immunizations. The vaccines recommended by the national public health experts for infants, children, teens, and adults are proven to prevent dozens of life-threatening diseases and illnesses. Vaccines also help keep your immune system strong.
Many of us living today don't remember what it was like when diseases such as polio, whooping cough, and smallpox infected millions of people every year and left tens of thousands dead or permanently disabled.
Vaccines now prevent these and many other deadly, debilitating diseases. Vaccines also protect our community by reducing the number of people who can catch and spread disease to others. Vaccines are a vital part of keeping our community safe and our economy open and functioning well. Unfortunately, Kentucky's vaccination rates fell behind during the first few months of COVID-19 as people sheltered at home. But Kentucky physicians' offices are back open. They're safe and they're ready to care for you. That means it's time to schedule your family's vaccines.
Raise Your Guard, KY, is the theme of a new statewide campaign we're launching today to encourage Kentuckians to see their physician and update their family's scheduled immunizations, including their annual flu shot. Updating our immunizations is one of the safest and most effective things we can do to protect ourselves and our communities. And by preventing some diseases, our immune systems are better able to ward off or minimize the impact of others, like the coronavirus that causes COVID-19.
Raise Your Guard KY is a month-long multimedia campaign funded by the Foundation for a Healthy Kentucky, the Kentucky Medical Association, the Kentucky Foundation for Medical Care, and Anthem Blue Cross Blue Shield in Kentucky. Please visit raiseyourguardky.org to learn more and share the message.
Hello, Team Kentucky. This is Lieutenant Governor Jacqueline Coleman. During this time of uncertainty, there's one thing we know for sure: vaccines work. We've all had to become more flexible about a lot of things during this pandemic, but protecting our families from preventable diseases means contacting a provider about getting back on schedule with our immunizations. I encourage every Kentuckian to do just that. Raise your guard against preventable disease. Starting with your flu shot, and talking with your physician about getting up to date on recommended vaccines. My 6-month-old daughter, Evelyn, has begun her immunizations. Like all parents, we want her to grow up healthy and safe. I applaud the Raise Your Guard Kentucky campaign. Let's work together for the health of our Commonwealth.